So when we get to Section 3 of the Charter, it sets out, well, here are the principles that apply. We've set out the rights that our courts and our common law traditions say that we already have. And later on, we set out, a whole bunch of kind of things that need to be in place for these rights to take effect. But what are the principles? So when a court's looking at the Act, or if a government body is looking at the Act, well, how do we interpret this? What are the principles that should be guiding them? And one of the principles is that all of us are competent to make our own health decisions. And I'm not talking about people that are dementing. I'm talking about the average person, you and I. A principle here is that we're deemed to be competent to make our own health decisions. If we're not deemed to be competent, then a regulatory body, and we've experienced this, will start taking treatments away in a paternalistic way. No, we haven't approved this. You can't take it because you're not competent to make your own decisions. We're saying that's false. We are deemed to be competent. Another one of the principles is that the individual is the best source of information as to whether or not a treatment is working for that individual. And this is terribly important because we can have the government say, no, wait a second, you can't take a treatment because we haven't approved it. And we're experiencing this time and time again. Well, what if that individual, what if you have tried all of the treatments, the approved treatments, and they're not working? It's not appropriate for you to be told you can't take something. We are the best source of information as to whether or not a treatment is working for us, and that principle has to be privileged and entrenched in our drug law and in our drug policy.